Basically, APN Plus is focusing on young people because there's a lot of issues among young people living with HIV that has been ignored for quite some time, especially in lower epidemic countries where there are less number of young people living with HIV. Therefore, there's no national policy or national programs that are actually specifically addressing the needs of young people with HIV. And the thing is that there's a lot of unique needs that young people living with HIV have, and it's not being addressed at all in some of the countries. Well, one of the specific needs is, for example, for those who were born with HIV, their great needs for sexual education, for sexual and reproductive health education. They need to know about their rights. They need to know about the complete information about sexualities. Of course, abstinence from sex is a choice, it's a matter of choice, but what we want them to have is the choice not based on fear, but based on informed information and based on knowledge as well. The other issues, of course, during the disclosure of their own status. So when they're children, sometimes they go to the doctors, and doctors will tell them, here, take these drugs, without knowing what those drugs are for. And sometimes when disclosure, when knowing their status is not done in the proper way, that can actually influence their social life, and how they think, how they develop and grow. And some of these issues are not even being paid attention to at the country level. There's no policy or protocols or system to address these issues. Young people with HIV, in many of the countries, there's a lot of internalized, in many countries, there's a lot of institutionalized stigma and discrimination, particularly in schools, because some schools requires HIV test before the students are accepted to that schools. And for children living with HIV or young people with HIV, this is a big problem, of course. In Thailand, if you want to go to medical schools, you need to get an HIV test. We met some of the young people living with the HIV in Thailand, and some of them wants to go to medical schools, but to actually help the others as well. And some of them can't do it. Some of them have to ditch their dreams and basically chase another dream just because the schools requires them to have tests, and they won't pass that test. I think considering the world we are living in, with the speed of information exchange and how it's really hard to actually control how information transfers from one person to another. I think it's really important, extremely important to make sure that children, even at younger age, they starts to understand, starts to think about sex, because basically they're exposed to that information anyway from the other. So it's really important to ensure that they receive comprehensive information about sex instead of letting them receiving information from unknown sources and something that we cannot control. So I think one best way to protect the children from HIV infection, or to protect children from fear, actually from fear of this world, is basically to educate them about sex and to make sure that they have the right knowledge and understanding. I think there are many trade agreements that are going on right now, and one thing that needs to be heard is that none of us is against the trade agreement. All of us is against the idea of people cannot afford the drugs that they need. So it's not a matter of canceling the trade agreements. It's just a matter of making sure that that trade agreements does not put public health into vulnerable positions. And right now we're trying to make sure that we're monitoring all the trade agreements that are going right now. And yeah, I mean I think that's the message that we're trying to send. Well, right now we're focusing on Thailand and India, because two of these countries are actually leaders, especially in this region, in terms of access to affordable drugs. And we need to make sure that both of these countries are actually protecting their citizens' rights, the rights of the people with HIV actually, in accessing the affordable access to medicines as well. It's still an issue, of course, but the problem is that with the politics at the moment, we're really struggling in keeping HIV visible in the world, because right now we're losing a lot of funding. There's a lot of other issues that distracts the global attention, of course. But we're trying very, very hard to actually make this issue still. The problem is that if we don't maintain our efforts now, then it's going to be, we don't want it to be visible in a way that we all realize that it's already too late. We want to keep it visible from now on, because we want to address the issues. We had the momentum already, and it's going to be we're going to fail whatever we already worked on for the last 25 years if we stop now. So we just basically can't stop now, or we lose everything.